I did tell him. So, yeah. She's been doing it for about 6 years.
It's closer to me. Yeah. Dapper. For real? No, I cannot. No, not yours. Yeah. All right, I'll go ahead and start us if we can stand for the pledge.
Of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. Happy New Year to all. Yes, thank you. Names and receipts. If everyone had a chance to review our minutes from our last meeting, if we can have a motion to approve. A motion to approve. Thank you. Any seconds?
Second.
Thank you.
Okay, Dr. Watson,
Yes.
Dr. Brunt,
Yes.
Robin,
Yes.
Dr. Osana,
Yes.
Terry,
Yes.
Rachel.
Thank you. Our next meeting will be on February 4th, 2025. I still have a hard time saying 2025. And up next will be new business.
Right, so there's just a few things to go over really quickly. We had been told when we took the last tobacco grant, and that's where we're partnering with the Tobacco Education and Prevention Cessation Coalition to have an employee that reaches out to the schools, that would be the last opportunity to that funding. And so we had planned, and we actually worked with our council to make sure that that individual gets moved in Town First, Indiana, at the end of that grant period. However, we did just hear that they are releasing a grant opportunity
Oh, wow.
that would not be given, but we would like to apply for the 2025 to 2027 period of time so that we can have that grant funding for that position. Chris actually is going to go to a session to hear about that, to see how that's different and if it possibly could be expanded funding for expanded program that we would work with the coalition on. So we just wanted to seek the board's approval to pursue that opportunity.
That's exciting because we didn't expect that at all.
We did not expect that at all, so it was very exciting when they announced that.
And from what?
So this would be from the State Department of Health.
We used to apply for these grants and would get them. And then the assumption was that now they're going to stop those grants and it'll come from our HFI funding. So now, we just expected that to not continue and be part of our previous funding. And so now to have a separate source is pretty exciting. Good for you. So I will present a motion to approve the investigation of the tobacco grant opportunity.
Okay, Dr. Watson,
Yes.
Dr. Brunt,
Yes.
Dr. Fleming,
Yes.
Robin,
Yes.
Dr. Osana,
Yes.
Terry,
Yes.
thank you.
Thank you.
And then the second item we have before you in the stack, and I apologize, it wasn't ready before we sent out the invitation. Just the first draft that was written today for our request for application for physical activity and movement programs. So basically, we're just hoping to have individuals or organizations that would like to, that are trained to offer different types of physical activity classes, so it can be dance classes, Zumba classes, Pilates classes, you can do cardio, drumming, things like that, that would like to offer those classes and kind of take them out all over the community, so that it offers opportunities for people where they're at and where they live, and some of our areas that are further out, and some gyms and things like that. And so it's pretty open for any type of activity classes that they would like to offer open to the public. There would be no charge to the public, or even let's get together and let's walk, let's run, let's bike, and paddling and things that people do. One of the discussions that we've had is you'll see the funding for the entire program. So that means all of the different applications that we would fund. that total is in there. There's a discussion as to whether to remove that completely, whether to put a max number on each individual funding opportunity. So if you want to have some discussion on that, or.
I was the one who gave her feedback. So with this, we're going to be presenting this to the community of who wants to submit proposals to us to help offer these programs to the community. I personally didn't want to put the total funding out there. I want them to kind of come to us with their proposals and see. I feel like if we put this big lump sum and they'll propose something for 50% of it or something, I just kind of want like their honest proposals without knowing what the huge total fund amount may be. But I do think the concept of like a cap for each fund might not be a bad idea, and it gives us less work to do to kind of like tear things down after the fact when we have to break everything down and say how much we're going to give to each person. If we can be forthright and say each thing will have a max of 10,000 or 12,000 or whatever we choose, or things like that. That to me seems more agreeable than putting it out there that we have this much of a line item budget for this program. But that's
$125,000 is for how long?
So that's how much we put toward the program.
This whole program.
For 1 year?
Yes.
Okay, that's what I was wondering.
Yeah, but that would be, all of the different people who put funding out. Somebody offering, executive offering to do it once a week in different areas of the county.
So we will vote individually on different programs that are proposed, so they can come in and
Yes.
ask us for the funding.
Yeah.
Okay.
So-
Anyway, okay. The only reason I ask is because I just I like the idea. I absolutely love the idea, but I can already see multiple pitfalls with the funding as far as what are the metrics, what exactly is going to be offered, who's going to be added, how are they going to, so.
Well, those are the things they have to,
Absolutely,
Right. Yeah.
absolutely, right. So
because we have to have those metrics, right?
Absolutely.
Because these are the KPIs that we have to submit back. So
Right.
in that proposal that they give us, they have to give us those types of metrics. I agree with you. We need numbers.
So when they're proposing it, that has to be one of the requirements, obviously.
Right, yes, and that's why Carrie and I were going back and forth too about, demographics and not wanting that to be a barrier and not wanting to decide ahead of time to be a barrier. So that's why we talked about the whole provide a sign-in sheet.
Right.
But everybody has to use our sign-in sheet, so then that way they're capturing that information.
And so then once they receive the funding, is it for the whole year, or is it contingent upon success at certain key points? Like, do they have to report to us 3 months, 6 months, 9 months to continue their funding, or do you just give them the?
None of our funding is just books.
Okay. Yeah.
So what they would have to do is, let's say I'm offering for an exercise class, I'm going to do it once a week, and I want $50 for my time to travel. I know that's really low. And I'm asking for equipment to buy mats for this many people. They would get the money to purchase the mats, and then they would get reimbursed as they do classes.
Kind of like those Purdue Extension things we voted on for like the classes, or like how we're doing with the YMCA or things like that. I feel like in my mind that's how I'm envisioning it.
And then they incur the liability?
So that is something that we'll have to talk
Because,
about.
I mean, that
We
would
could
be
talk
my
about
concern.
having
You were right.
certain locations set up.
Yeah.
So like, let's say we grow high school gym because they were wanting something in Blue Grove and they would group. So we would arrange for that space, or we would first arrange for that space, and then that's with working with liability insurance. We're arranging the space. That's what they would ask for. They would ask for.
Right, that's what I'm wondering.
Yeah.
Who, and then is that part of the funds? Like, does it go toward or the cost
Yeah,
of
so that, the liability insurance wouldn't be an extra charge, but if we had to run a facility.
Yeah.
Right, then
Okay.
that would have to come out of total programming cost. But I wouldn't expect the individual to incur that, because we're asking them not to charge anyone.
Yeah, that's a big deal too. You don't have to be a member of anything, or
Right.
it's free to do. I know, well, how we.
But still, waivers don't do anything.
Correct.
Like,
But at least-
That's good.
Yeah.
Yeah.
Comfort.
Idea that-
We don't want to create any more work for Dave.
Correct.
Yeah, that's what we don't want to do.
Correct.
I didn't say that.
So this is just for the, chronic disease prevention. This isn't for the other one that we're working on for the
organizations, or is this through all?
Correct, so this
It
would just be for the reducing adult obesity.
Okay.
One of those 4 things, yeah,
Right.
yes.
I was just trying to like make
Yeah.
sure. Okay, so
Yes.
those would make it to us another point of what we're doing for that, so is that correct?
Right, and there may not be, so for example, for, increasing required immunizations for children under 3, we might not put out any requests for proposals, because that's all things that we're gonna approach via outreach, and here.
I would say that maybe just to increase the potential return on investment for this, there should be some sort of metric to potentially incentivize getting people that are obese to lose the weight versus just anybody showing up to actually work out, if that makes sense.
So these activities will all be part of the Porter County Wellness Initiative, that we talked about expanding that. So as part of Porter County government, we have a POCO Wellness Connection initiative. It's just for the government employees. But that's something that we're looking, Commissioner Reagan started that we're looking to extend to whole county. So these things will all be programs that will be part of that. Anybody who participates in these programs is on the sign-in sheets will get points, POCO wellness points, as well as we're hoping any of the programs that people participated in, like Powers Health,
Right.
they get sent out, the Franciscan thing,
Right.
our Parks Department, all of those programs will be things that people will be able to get points for, in addition to other types of wellness. So if they're participating in the gardening program,
Right.
or a weekly program, things like that. And so there will be a whole bunch of different things that are part of that.
Super
whole
exciting.
initiative. So where we're at with that is that we're first starting with a portal and a tracking system. So we have to figure out how people can sign up easily and how we're able to track that, and then from there, we'll start.
But it almost be cool if they almost like a quarter point if it's or something. And then like they could go.
Definitely some sort of incentivized
Yes,
program.
if
That's
they're
the start.
Right.
Yeah, so-
That's a great idea.
If somebody at least get that going.
Yes.
Like you saying, there's an incentive to like.
Oh, yeah,
Yeah,
for sure.
$25,000 for the program and $100,000 for the person. I mean, there's a lot of people here.
Incentives are nice, I think. I know.
Yeah,
Right.
because if your KPI is a decrease in adult obesity rate, then there has to be some objective measure of the KPI to report back. I mean, it can't just be number of people that come to a class.
Right.
Which is great, I mean, that's still great data, but if we're making our KPI this objective measure, then we have to collect that data. Right,
I mean,
yeah,
it's
I
a
know.
well, people know sign up for this.
Yeah.
Yeah.
This is just, I mean,
Yeah.
I don't know that I'm not saying we're gonna do this, but
Right.
even if we did something like that, or it was a competition, people signed up and then there's a way to track them.
Right.
And then, I don't know. and-
We had a lot of discussion about this in different, like, brainstorming, like, we were thinking, like, how do we focus this with adults? We can focus towards our youth, having schools have competition amongst each
Yeah.
other. So I think the incentivize, and I think competition is always fun. I think those types of things are definitely where I think we're all on the same page in terms of how that would be more impactful. But then Commissioner Regners was saying something that I thought was really important. Like, everyone's like start point is different, so I don't want to dissuade anybody. Like, even, so everyone's, you could have someone who's really, they already run or they're already very physically active, but maybe they don't do other healthful things or mental health and different other components of things. So
I mean,
we want them all.
You could have something also work.
Yeah.
Well, I'm
Yeah.
okay with
So many parameters.
doing her, all kinds of
Right.
reasons.
So then you might want to add, because if you're collecting the data for these deliverables, but yet you're going to be attributing it to this outcome, then maybe have some more outcome indicators. I don't know. I mean, because otherwise the data that you're collecting isn't representative of what you're actually measuring.
So the BMI measurements, how they measure the adult obesity, that is through that data that's collected from IHI through the state. So
Oh,
we are going to collecting our own BMI. So we're out there, we have all these programs out there incentivizing people to participate in these
Right.
programs, increasing physical activity, to move the needle on the utilities.
Okay.
We did meet with Dr. Weaver today, Dr. Lima, and I did.
To answer one of your questions
Yes.
down the last meeting regarding that, where are these data points coming from? There was 3 organizations listed. I was one of them. And she was saying that it's just not sick people who are getting BMI data from the hospital. It's actually if you came in for radiology, deployment, outpatient, or things like that. It's all these people who go through the door and then get vitals and BMI subject. It's real through.
And she also was mentioning that because they know, and the registry's really working on this, that this is where we're getting this data, and the data is so important to legislators, to all of us,
Right.
that they're encouraging providers also to begin putting, information in time, so yeah.
But, I mean, I guess the ultimate point that I think most of us are trying to make is that it doesn't become, the incentive of the program is not to just get active people that are already active.
Yes.
To come
Right.
and give them
Right.
free exercise classes.
Yes.
Correct.
That's the idea behind it.
Yeah, we want to move the needle of people
Right.
who need the needle moved, yeah.
Obviously, people that are already doing a lot of these programs, we can fund them some way. So
Yeah.
that's always-
Yeah.
Yeah.
That's nice. Yeah.
Yeah, so this will go out and we're going to go, it's not out and as well, our community partners and how long do we want to put people work?
Because they come in, hopefully, right?
Yeah, so we definitely want to make the change to remove the total program funding available and put a maximum out program opportunity. If everyone is okay and you'd be willing to vote, now it's up to you when we would put it out and get them back, Monday, February 24th, and kind of go through them and.
They're due by Monday,
Yeah.
February 24th. Is there a max amount you think each program should be limited to?
Percentage.
I was, yes,
Way more than that.
Yeah.
I would think so also.
Or even just sitting here on applications that are verified and determining how to distribute that.
And we use that too. You know, I was basing it off of, things that we apply for and they typically are, this is the max amount. And then sometimes they will say, no program will be funded at more than this amount or something like that. But they usually do that so that you know not to.
I think I don't mind putting the total number in if we put in a total max also. Just because we've just been dealt with a lot of these like reaching for the stars kind of
Yes.
proposals that we have to like behind the scenes kind of whittle down, and it's, you know, I want it to be a realistic proposal.
And we'll keep, depending on how many meetings we have, we can do that like next board meeting or we can do that with the other question. Yeah, we might want to call a special meeting.
I think it depends on how much comes in, how much work we have to do. We're willing to put in the work and not make people wait too long to get things going forward.
And you
See what
already have your rubric for how you score each one of these things?
You know, that's what we'll come up with. But I put
Oh,
this together
okay.
today so that we can
Because
make it-
are you gonna share that with the applicants?
that is, yes, we can share that with the
Because otherwise, how would they know?
Yeah, usually those are in their proposals to us.
That's in the proposal.
Yeah.
Yeah,
And also, like,
to be fair.
who is going, how are we gonna get this out to the proper people, like, how are we gonna advertise this?
So we have a specific website where we're partnering with them.
Right.
So we'll link it there, and then in all of our partner meetings, we'll announce that we have them out. And then as well, we will send them out to individuals that we know. It's really great having recommendations or we know as well, and we can make it available to share. So,
I think it's exciting. Good for you.
Because I can foresee, for example, getting some of the local businesses involved, like, like have a flyer maybe, for example, for the people that do, like the, the aerobics classes, things like that, the yoga studios, things like that, so that they know that
Yeah.
they wouldn't go to the website necessarily,
Right.
but
No.
they would probably have a great idea as to what we can do. They do this all the time.
especially since it's new.
Right.
Yeah, and it would be wonderful if, you know, you had to, and they would love to do outside classes somewhere. It's nice, and,
Yeah.
you know, that.
Professor,
Exactly what we do.
teachers at the YMCA, for example, that teach classes that would have ideas on what they potentially could offer us. That's
Yeah, absolutely, so those are all things that we'll reach out.
So is 15,000 or do you 12,000? What max amount?
Would it be a percentage of the number of applicants submitted?
I feel like they might be on a rolling basis.
Oh, it's gonna come in, you think we're gonna be reviewing?
I think so. I would, like, if things come in that are good, I would feel good moving forward with, even if there's one at this time and then another one comes in a month later.
Whether, you know, so you have somebody who's got an inside
12.
Well,
Depending on the
Proposal.
may change, but
Yeah.
they don't, I do believe that they.
Right, or 125. That's why I
Yeah,
didn't want to be like,
that's
oh,
what I
125 is open.
Yeah.
Most applicants have been pretty consistent. They ask
Well, sometimes there's a lot of work behind the scenes to get it to the point of application, and sometimes we have to give them feedback and say, oh, well, that doesn't really fit the bill, or this is not going to go through, or that type of thing. So, because we have to meet these parameters and the data that we have to submit. So, I would be willing to submit a proposal to move forward with this chronic disease and prevention reduction program, to set the applications out, with the inclusion of the total budget about of 125,000, with each individual proposal to not exceed 12,000. Pending board approval and discussion.
second.
Dr. Bob,
Yes.
Dr. Brooke,
Yes.
Dr. Fleming,
Yes.
Robin,
Yes.
Dr. Rosan,
Yes.
and Terry.
Yes. Thank you.
Then we were approached with an opportunity for WBLP, for Demetrius to have a degree spots.
Oh,
So he has been getting some things together, for different topic ideas, what we wanted to, there would be an annual, $350 annually for a broadcasting fee. And so that would, you know, come from our regular advertising budget. It would be an hour time slot. There would be times, I'm sure, when they would run probably repeat episodes.
how often was this for?
Allow us to keep
Weekly. Oh, that's
They
a
said weekly. I talked to them a few times over this past year. We said we can even do something that would be even bi-weekly. They just really want us to take
Wait.
advantage of the opportunity.
What are they looking for? When they presented this, like, what were they asking of us to
Just
present?
a show for the health department, just to talk about what's going on, our updates, our different partnerships,
for different divisions.
Different divisions.
And then go into partnerships within the division,
Right.
or we can go into more service areas.
I mean, we have a lot of different things to talk about. I could interview people, like different department heads, even people from the departments, like routine food inspections with Susan. We could talk a little bit about the needle and sharps disposal program. What else do I have? The importance of like birth and death certificates. I feel like there's a lot of things that we
I
can
like
tie
I like
into.
how you're using all the different subcategories. I like that people are listening to the radio.
That, and, you know, depending on what current events are going on in the world, we can really tie that into what's going on at the department as well.
And Demetrius will be in charge of the development of whatever the topic of conversation is at that time.
Yes, and I will point out, that they do a podcast production for the Health Coalition, and Carrie's been on, that for the Suicide Prevention Task Force, and they really work to promote that, and their listenership, has really exploded. I mean, if I
Oh,
can use that term.
That's good to know.
So, and then Councilman's also has a radio show that we've been on different divisions at different times, as well, so.
Well, and then I know we're always looking for data of how many people we have outreach to. This expands it tremendously.
How long is the show gonna take, an hour? Or
We can decide that, they fixed an hour. I said that might be like a little long, especially weekly. If we can maybe do something bi-weekly or in that half hour to 45-minute range. It really just depends on the day, I really think, because like I said, depending on what's going on in the world and what we want to talk about, I think we could fill an hour.
Okay. It's exciting.
And that would be a platform for us to advertise.
Yep.
Yeah.
I like it.
I like it too. Great idea.
When would that start?
Don't ask me.
When would that start? Like right now? Like when
Oh,
would you
I
start?
think it could start as soon as.
As soon as I
Oh,
get a
yeah.
little fall
Yeah.
on the grid, I think we just wanted to bring it to your attention.
Yeah, we have different
Mhm.
So like we get a set time, like on Monday, every other Monday is the health department from 7 to 8 p.m. or
Yes.
something like that.
Yeah, they would carve out a slot for us, and yeah, we'd
Is
have
it
to do some.
pre-recorded or is it
We
live?
can't pre-record it. That's what the hub does.
Okay.
Can you put it up as a podcast that can be subscribed to maybe?
I'm not sure if they do that. That's a good question.
Now that hub does that, so it's
Reference list.
It's a great way to follow. Yes, that's true. As a reference catalog.
Yeah, because that'd be nice on the website if people could, like, for example, if they wanted to know about like Narcan, for example, or if
Yeah.
they wanted to know about where to dispose needles, if they search the website to be able to have that podcast available, I mean, that would be ideal.
We do have something on our website for our media, so.
We could
if
add
you
that.
bring that
Yeah.
to WVLP, I can get that link and start.
Yeah.
working on that stuff.
How exciting.
That would be
Good
awesome.
Dr. Steiner says the SBA prevention.
You need to
Go back and
be prepared.
Brush
to be
up
asked
on
to
the
be
topic.
on.
You never know.
You never know.
Be prepared to be asked to be on.
Yes.
prepared.
Yes.
No, no, not.
People will have to be on the
Yes,
show.
the 7.
I already did the video, so move around. I've done my due
I mean,
diligence.
honestly, if you just get Dr. Fleming to appear on the first podcast, you'd have millions of viewers because he's so, so popular for our county.
Lady in her own money.
All the ladies would come flocking to the podcast.
My lord. So do we need a board vote to approve this? Is that what we were looking for?
motion to
Motion to approve the WVLP opportunity. I second.
Okay, Dr. Boston?
Yes.
Dr. Brunt?
Yes.
Dr. Fleming?
yes.
Robin?
Yes.
Dr. Hassan?
Yes.
Terry?
Yes.
Thank you.
Very good. Yes. We a radio star. All right. Any old business to attend to? Edna? Okay. Report of board attorney.
Brevity is a virtue, so
Yes.
I'll not bore you with great detail with all the things we've been doing, but I've been working with the staff on implementation of the Health First Indiana programming, and all the MOUs and the contracts and agreements that have precipitated therefrom, and I'm sure will continue as the program continues in its implementation and success. Spent a lot of time since the last meeting trying to monitor the reconfiguration and structure and appointment status of the board itself. We are dealing with a new statute that we have not had in the past. Past it was simply the Board of County Commissioners who made the appointments to the Board of Health. We now have a component of the County Council coming to the table statutorily, and the Mayor of Portage coming to the table on appointments. And so deciphering that and trying to figure out who's on first base and who's on second has been a difficult process, but it culminated today at the commissioners meeting. We thought we may bring some closure to it, and all that happened is they tabled the whole thing and didn't do anything. So we've got probably at least another month of trying to work with our commissioners and the mayor and the county council to implement our responsibilities to fulfill the statutory requirements of the new configuration of the board. And we'll keep you attuned to that. After the county council meeting, we went up and I introduced our staff, our health officer and Carrie, to our new county commissioner, Ed Morales, and he indicated an inclination to want to join with the health department staff here pretty soon and learn as much as he can about what's going on in the health department. So that'll be an opportunity to really get in on the ground floor and make him know the significance and the importance of the endeavors that we engage in.
I don't mean to interrupt, I apologize, but just to finish on the first point that you had, does that mean that the open position that we have currently won't be filled until they sort that out, essentially?
We have two.
It's in the mix.
Yeah.
And so you understand, it becomes, I think the whole thing was written by a lawyer.
Honest to God.
It's so convoluted.
Yeah.
You got layer upon layer upon layer. For instance, we have the appointing authorities now that are at least three.
Right.
The commissioners, the county council, and the mayor of Portage. And on top of that, we've got a requirement that no more than a simple majority can be from the same political party. Another layer you've got to fit underneath the whole thing. And then thirdly, in terms of the whole process, the statute creates terms of office that are somewhat different than what we're traditionally related to. So stacking all that together and stepping back and hoping the wind doesn't blow it down, we're trying to accommodate the commissioners and giving them suggestions and ideas and working with both them and the county council and the mayor to see if we can come up with the best combination. I will tell you, every effort's being made to preserve the integrity of the current makeup of the board. Where that will fall out at this juncture, your guess is as good as mine. But after waiting and working and being ready this morning, they did what any good politician will do, kicked it down the road, right?
The reason I ask is because of the quorum necessary to keep this going, because as we have 2 seats open, that puts more pressure on everybody to be here essentially, so like the time frame. So
Well,
obviously you can't get that
the position isn't replaced until the replacement is chosen. So
Yeah, absolutely.
if they push it back, then we keep,
It's gonna be,
here we have our,
until the new rules are in place, that we know.
Yeah, I mean, I'm fairly confident that they'll, I think just think amongst themselves, they have to figure out which one goes first. One picks Republican, one picks Democrat. I think, and-
One from column A,
Yeah,
one from column
yeah.
B, 2 from column C. Oh, we can't do that.
I say we just get a good cage match.
Oh my God.
And the winner is?
When it's your turn to come up, we can
Gold belt and a seat on the Board of Health.
we just wait to see what they do.
That's, all we can do is our best to preserve as best we can the integrity of the current structure while at the same time complying with the requirements under the new structure. That's all I have, unless there are any questions or concerns or comments anyone would like to make.
Thank you. Claims and receipts, have they made their way around for everyone's signatures? We can have a motion to approve our claims and receipts. Thank you.
Dr. Boston,
Yes.
Dr. Brooke,
Yes.
Dr. Quinn,
Yes.
Robin,
Yes.
Dr. Hassan,
Yes.
Terry.
Yes.
Thank you.
So if I may make a comment on the claims and receipts, I look at them all the time, and I think my eyes kind of roll as a doctor. I don't do receipts regularly. I know a lot of us probably don't look at spreadsheets. I think it would behoove us, especially if we are going to make any further recommendations, if they ever come to us to ask us for a recommendation, that potentially we have somebody with some financial background that can look at that and give us some insight into it. Because at the end of the day, I don't know about you guys, but I'm not a spreadsheet guy, so I know a little bit about these things, and I can look at it and guesstimate it, but it'd be nice to have somebody that could really digest that for us, if that makes sense, from a financial standpoint.
Balance.
Yeah,
See,
I don't
kind of
know.
balance out.
I'm being honest with you guys, and just, I don't know what nothing costs at the end of the day, so I look at that, I try to make the best estimate I possibly can, but I'm not an expert at that. I know public health, and I know my health in my office, but I spreadsheets are not the thing, if that makes sense. So maybe having somebody that does that for us.
In how often?
No, I don't know, I'm saying like if there is a suggestion that we can make, if they decide to come to us, because I know that part of the process has been that we recommend people, and we have somebody with some sort of financial background.
Oh, you mean for the board?
Yeah.
Yeah, there are different parameters of like what kind of background, but I think one is even general public.
General
Yeah,
public.
but I think that's, we're not the ones choosing. So
That's
for
true.
those who choose, what skill set they value.
Well, I know-
Yeah, because we don't get to choose.
I don't just, well, I know we don't,
Yeah.
but I know that we have the ability to make recommendations as far as like what potentially could be needed for.
Yeah, environmental, financial,
Absolutely.
legal. There's a lot of.
I mean, if you know anybody that would be interested.
I know, right?
Yeah.
But I think there's something
No, I think the application window closed a while back. I think like for the council, it was the end of the month, and for the commissioners. But I don't even understand the commissioner ones because that comes from the mayor. I don't know where those names. I really didn't even know this changed until last week, so I don't know how. Yeah. Because people had even asked me, and I just told them to look on the website and see where the public open things was, and it's changed. I don't know for the mayor of Portage if that was even open. For someone to apply, I don't have no idea. It's kind of nice that we didn't have to do it, so I kind of stayed. Mhm. Absolutely.
Would it help on there to have what the line item that comes out of so that you can see, how that is? So some multi-contract on there so that you can kind of see how it's.
Right, like broken out.
That line item, is that what you're kind of looking for?
I think it might help because, I wouldn't know. I don't have a perfect example, but let's say I don't know, envelopes for the county is $300. Hypothetically, let's say I don't know if that's an accurate amount for envelopes for the county. At the end of the day, is that an appropriate amount? I just.
Oh, I see what you're saying.
Yeah, I'm signing off on it, saying it looks okay, but I don't buy envelopes for the county.
We need an envelope specialist.
What?
Staples. Someone from Staples.
My point, having somebody with some financial
Sure.
understanding that does these kind of things would be nice to have somebody review it, that outside of the board or maybe outside of the health department that can look at that objectively and say, yeah, that seems like an appropriate amount, because I will be honest with you, my judgment in that is
Difficult.
is
I think that
arbitrary.
once a year when we get it and you give us the budgets for the
That's
years,
what I was gonna
that
say, what we can do
yeah,
we can
is
budget
helpful.
approved,
Yeah.
we could show it, deducting from the budget, but as far as making sure you're just up to the mercy of trusting us that we shop for the rest of the week.
Well,
we have to work in our budget.
And I trust you guys completely, but
yeah.
from a transparency standpoint and from a board standpoint, having us vote on that every time we come every month, I do my best to do my due diligence to look through it to say yeah, that seems about right, but at the end of the day, just being open and honest, that's not my forte, and I don't think that's the forte of most
Being
of the
open and
people.
honest isn't your forte.
No.
I'm just trying to wonder, is it quarterly? Would that be helpful? Because just some things are so fluctuant based on when you order things. When would that information be most beneficial to review? A quarterly
Well,
review?
fair enough, but so let me actually step back. I think one of the big problems that I know that was an issue is the accountability of the money that's being spent, towards different programs and towards what the board health is putting out there. And I think that's been one of the sticking points of a lot of the politicians that are getting involved and starting all this. I think that's one of the reasons that all of this is happening. So if we can create some sort of self-governance where we have the board having some outside way of reviewing that spreadsheet that's not tied to just trusting the health department giving us those numbers, I think that would give some reassurance to some of the politicians that the money is going to the appropriate locations that it's supposed to. So at the end of the day, I don't mind voting on it, and like I said, I do my due diligence, but if there could be a layer in there that could reassure the politicians that somebody else is looking at that understands what they're looking at, I think that would be beneficial to reassure some of the people that have questions as to whether or not the money is appropriately being allocated.
Yeah, and it's all linked on our website.
Sure.
And I'm not, so we
Right.
basically have somebody have access to it, because when you look at it, you're looking at two different things, right, because it's all these lines. But what we have to break down from the state is so specific.
Okay, and do they have a CPA or somebody that's looking at it to make
Yes.
sure that it, okay?
There is each region, North region, South, Middle region, South region, all have a financial analyst,
Okay,
and they go through everything, and we go online right now and pull it up every.
They give you a
line
report.
Of the 3.388 million, it shows, it's called a spend plan, so it's not a budget for them, it's a spend plan, this is how we plan to spend it, and every time we make a change, that has to go to them for approval, for that,
fair enough.
and then they give that to the legislative
Yeah.
county.
Is
So-
it, how often is something like that reported or evaluated every time a line item is changed?
Every time we submit.
Because, to be frank, there isn't gonna be a person that will be able to look at this and know how much an envelope is. Or,
Right,
for example, so there isn't. Now, there is somebody that's why I've looked at over the last 10 years we've been doing this. Sometimes something will stand out, there'll be a brief discussion, but largely it's just check and balance through so many layers. So to your point, validate that from a political standpoint to make sure nobody's trying to get in the middle of something that's not broken. Maybe having that note quarterly, that, by the way, the last CPA or the last financial analysis was done on
Right,
April 13th, which to his point, when we're saying, yes, it's fine, it's also saying we're relying on this, that's why we say it's fine. So then at least you're taking out that suspicion
right.
and make
Yes,
us feel more comfortable.
So is there a link to the auditor's report that we can see?
There is a link to what we submitted, was approved through the state for our
Yeah.
spend plan. It takes every single line item and breaks it down, not only by core service, but about percentage of their time. So for every single person's salary, we have to say how much of that is
Allocated
toward
for that.
the 60, how much of that is toward the 40, what core services, are these equally distributed between those core services? If not, what percentage of that, like it is broken down that finite, can be the same exact thing for every benefit for that same person.
So it's very
For
transparent.
every-
Yeah, you just have to
It is-
dig for
it's
it.
public on
As
the
long
website.
as we have the ability to see the transparency and to convey that to other people and to
Share
confirm and make sure that it's reliable and valid, right?
So if you go on our website and
Yeah.
you click Help First Indiana,
Uh-huh.
and then you go to the Help First Indiana link, it takes you directly to the county's Help First Indiana page, shows how much they gave us. If you click on, I don't know, ledger's
Yeah.
plan, up pops exactly what we have to submit for approval, and it gets posted up there when it's approved. So so that anytime we change anything, so for example, the, modifications that we are going to go for council request, which were already made with the boards and we changed the health officer salary, and making sure that all has already been submitted for approval and is updated. So the latest, partnership proposal we had that was approved with JDC, so that's all in there, that change had to be made. Because that was due then originally, kind of August, September. And so then those changes all had to be made, so that's all up there.
So here's just a thought process, like, we have Dave here, right? And legally, he's reviewing all the different things legally from a legal aspect. Potentially, we can have that kind of a position. I know that would be an excess cost, but to have somebody that makes sure that for county decisions and for county money that's going out, there's a CPA potentially that's reviewing that from an outside perspective, like Dave Hollenbach, from an attorney standpoint, from a financial standpoint, there's some sort of financial oversight on the Florida County. I don't know if
Yeah,
that's.
the auditor, would that be what?
Yeah, so we get audited.
Okay.
Maybe every time something like that occurs, whether it's financial analysis or auditor's note, when you pass these out like you do every month, you put a little asterisk at the bottom.
Yeah.
FYI, on December 15th, the auditor reviewed these financial statements.
Because you do that a lot.
Yeah.
Yeah.
Absolutely.
I know you do, yeah.
To
Right.
your point, I mean, look
We
at
could have
something,
documentation of
at
it.
least you can say,
Yeah.
Right,
I have faith that this was done.
right,
So that might help.
Well, and documentation of it,
absolutely.
because we know if it isn't documented.
I apologize for the extra work, I'm sorry.
It's good. I like it. All right, so report of committee, staff, and health officer. We had a lot of good stuff this year. No, you're not. No. Exactly. All right, who's,
I'm sorry.
Yeah, well. That's exactly.
So there are some summaries in front of you. Now, this information is all taken from information you get in some of your reports every month, but I took and put everything together. The state has a core service track that we put everything into for them to pull from for their different divisions, to give analysis of what each of the counties are doing, and also to the legislators. They printed that out, sent it to us, and it was not something we would like to look at.
was it user friendly?
So I took and put everything into this area and separated by core service. And of course, a lot of these are services that we have always offered historically in the health department, plus our additional programming and our partnership programming through Health First Indiana. So this is just kind of to see the numbers and everything that we have done in 2024. So just kind of thought we think that that's interesting, and tried to put comments about programs that have just recently started. The Reducing Undiagnosed Diabetes in Porter County Initiative with Powers Health just began in October, and they have done some amazing work in those few months, as have a lot of our partners and things that we're doing in-house as well. But I was really that, and we also have a miracle for our volunteer who is working with us currently in the amount of blood pressure hearings that she's done, classes that she's been offering. That's why I wanted to include that Life's Essential 8 the flyer in with the information that you received in the email in case you have any patients that you wanted to refer, anybody wanted to come check it out themselves. She is pretty incredible. So those are some programs that we're really getting some very hands-on things that we're doing in-house. And so I know that you just got this tonight, so please go for it, reach out if you have any questions you have now for clarification, or if you're looking at it later. And then the subsequent pages are, I think this is really interesting. We look at this every month as far as Facebook or social media interactions. And those are really interesting to me, and it's really nice. Sherry runs the Suicide Prevention Task Force Facebook page. It does a really great job. Of course, we just started all of the Porter County Health Department social media pages. Does the same, and they do a really good job breaking down what each of those things mean. And it's always really interesting to me to look at the content interaction and where we're doing. Of course, we would love to have more followers, and so that is something that we are hoping with the Code Connection initiative and some of the programs that we're going to really be able to resolve that as well. Partnership. So just kind of thought that was really interesting. I also wanted to give an update, speaking of the AmeriCorps Heart Corps volunteers. So part of that partnership with AmeriCorps Heart Corps is putting blood pressure hubs in place. And because of some of the trainings and programming that she has offered, they have given us a site toward that. We also had some money toward that in our budget for 2025. And we've been talking, we would really like to put one of the hubs, or our first hub, in the health department lobby. We were really thinking that with the veteran services being right down the hall, the way the buildings use, or the voting's in there a couple of times a year, that we could have that hub in place in time for our ribbon cutting for the new expansion, and then also we would have some media exposure without letting the community know that, hey, it's here. We would come in, take the blood pressure, the education from it, also refers directly to Footline, which is great for our partnership with the Tackle Coalition.
That's great.
So that's kind of what we were thinking as far as that hub placement. Also, we do an update on that. and discussion. Is it what? Yes.
Like, you don't see those as much anymore. I know, and people would bring me like little logs from when they would stop, you know, so I think this is,
Access to whole blood pressure.
but yeah, it's changed.
It's not $140, it's $30.
Right, with the garbage. Yes. I think it's a great start. I love the summary. I think this summary kind of fits to what Dr. Osan was exactly alluding to, the kind of information that we need that we can hand off and say the things that we do. Here's like direct numbers. The rides, is that included on here?
Yes.
It is. I don't have my sheet.
You're fine.
Yes. I need to start
I like
remembering.
little graphics, it really, you know.
The color, all of it,
To have
yes.
written the course over the area below, and then, you know, it was so tiny.
Because I saw that they posted it.
Memorize these? Yeah.
I mean, that's the tattoo one's great, I love the tattoo one, that's one where I'm.
Listen, I can't see.
I need right here. Yes, the nurse, very
Okay.
top one. So those are the.
Oh, there, okay. Yes, because they posted that yesterday or the day before, 2,400 more rides. I think that's
It's June.
incredible.
It's June. And remember that when they originally started the program, the buses went down as well.
Yes.
So-
And I just remember when we got our,
Survey results.
yes, the survey results, the needs assessment results, and they came transportation. We just thought, how are we going to be able to help with transportation from the health department? And the fact that this has come into fruition in such a great way in such a short amount of time is very,
And let's take a little bit of time to
yeah.
kick off. We were really surprised by that.
Me
Right
too,
in the
yes.
report, but Carrie just scheduled to today.
Okay.
I have two this week and right there, and then a return ride, so they're able to get a flexible return ride, so when their appointment's done, you don't know.
Sure.
And so they can just all their ride. And I have two, these are two individuals, I do believe will use it monthly.
Okay.
You know, of course, I encourage if they have Medicaid, to use Medicaid transportation, because that is a benefit they have. And then I put on my report how they Uber ride from being funded, so I anticipate them.
And then below those numbers and then all the social media numbers are Carrie, did surveys for the bike program, just to kind of check in with everybody. With Heather Bike, you can see there, those that she was able to get a hold of. So everyone was learning that they have their bike, we've got some comments. One of the individuals actually expressed that he was so excited to tell her that he had lost 40 pounds.
Wow, yeah.
Is he writing it right now?
So I actually do see people every day on my way to work, riding their bikes to work,
Proud of them.
grocery store daily with their wraps on the back and stuff strapped to them. And you know, I drive from here to just right off of Philly, so you know, I just drive through town. I see them all. There was one day I saw a gentleman, you know, in full rain gear, and it's pouring down rain.
I think we all forget that it's not just the one thing, it's the many. And those many little things are picked up in the community will just explode with thoughts of being more healthy and how to get access. It's just what happens in communities where you see this being successful. It's been around for hundreds of years in some degree, depending on what culture you go to. This is how it starts. Access. People see other people, talk to other people, you look at these numbers, even in a short amount of time. That's how a community gets healthier. This is great.
Very good.
Thank you all for your support and your input and feedback on everything all along the way, so we really appreciate it. I wonder if the board feels that it would be an appropriate time to request a continuance of the programs that we do, the health department does, individually. And we have budgeted for going into 2025, so things like the car seat program, the car seat fittings, the diapers, wipes, and sanitary napkins and food pantries. Use cardiac screens, the backpack snacks, we do helmet distributions at auto events, harm reduction kits, we do different trauma, and injury prevention training, salvage, CPR, mental health first aid, we did like some safety and water safety things. The bike program, Heart Health First Indiana, actually we didn't get very many takers with the two that contacted me, have followed that up requesting to revisit that again, so that was one of the things that we had approved in our day out for, and our AmeriCorps Heart Corps. So those are some of the things that we do in-house, that would be great if we wanted to,
Do we approve those that are regular budget approvals, or do
yeah,
those?
so they were all in the budget.
Yeah.
Because of the year that we started and doing the year, so.
I think it's fair to continue in that pathway.
And then the only other thing is I had a question for procedure for the partner program. So as we reach the year
Yes.
for those programs, I wanted to kind of see what you guys, do you want everybody to, if they are requesting the same funding, do we still want everybody to come back before the board for a re-proposal?
I vote yes.
Okay.
That's
why
me. I vote yes.
Okay. That's why
Because that's how would we know what worked, what didn't work? I mean, especially when it was just year one. So I don't think anything has proven itself effective yet without coming back to us and showing their data. So.
I just want to make sure because it's the whole having a renewal and new one starting up.
And I think when we voted, you're right. I thought that was our assumption that we would reassess. There's no.
And honestly, even the ones who don't want funding, I would like to.
A summer.
Yeah, even if they can't make it, you can give me that kind of short summary.
Well, they have to submit it to them. So even if they can let us know what was submitted to them by the Portage YMCA or whoever, that type of thing. So I think absolutely.
Yeah, I mean, that was the original expectation.
That was,
But
yeah,
there's
my
data
feeling.
metrics that have to be reported, otherwise you just don't need to say it is.
Oh, yes, and that's all, I mean, they're reporting monthly, and you guys are receiving that in your
Right.
reports. I just wanted to make sure when the agenda starts to
Yes.
get, you know what I mean, that we're,
And there's a lot.
yeah, no,
Yeah.
absolutely.
And I think, that's how this worked. This didn't work. This is, we want to go in this direction. This is, so that wasn't a great idea. Yeah, no, I 100%. I have to say, when Jamie came in, I was really impressed with the report that we got from the school liaison this time and the planning and the programming that she has begun to work with the Valparaiso School District of just different information packets to get to the students and parents. I thought that was very impressive. I was very happy to see that. And it hasn't even started yet, and the amount of work that was in what you submitted to us was very impressive, and I'm excited to see more about that and hear more about that. Yeah. Very good. Yeah, they really are. Great job. Any miscellaneous? No. Any?
I read it, but,
You love them. You should. Have you looked? You should go down.
I'm saying that.
Yes, she loves it too.
I
She does too. She's so good at it. Paint colors and all this.
was going to propose, you tell me that, because we'll be back in Valpo in February, they will be maybe completely wrapped up with phase two, so we want a tour.
Yes.
So we either can do it, I mean, I'm open to like full tour or all together, either before or after the meeting, or if you guys want to do kind of like a mobile unit, just whatever you want to do.
I think how we did the mobile unit was nice. It was open. Anyone who got there early could walk through and see. I think that's very exciting.
Or the night, yeah.
Really.
Yeah, so, they're painting right now, it's so exciting.
I think it's good by the end of the month.
This phase, yeah.
So it was February the 11th is when phase two is set, well, we would do punch walk and those items. But I will say they seem to be, it was running ahead of that schedule, but now we're probably behind a little So I will find out next Wednesday if there's a new date or if they're still gonna hit that date. They were thinking they were actually gonna come in even earlier than the 11th. So we'll see. I mean, it will be very early then for our next meeting time.
That's so exciting. I'm happy for you guys.
We'll probably over
Well, that's what, May?
May.
Because everyone won't fit back from where they are, so it's still going to be a. I know you do. I know. It's been a word. Yeah, it's exciting. Awesome. Anything else? Any public comment? Okay. Well, then a motion to adjourn. Thank you. All in favor, say aye.
Aye.
All right. Get home to your house.
Yeah. I think I should